opening statements from both of you kind of have me thinking a lot about, that there's work for people to do on both sides, both folks who are Indigenous and those who are non-Indigenous. Um, Sometimes when I look at, system transformation within healthcare, um, a parallel I sometimes make is like people who actually are living the problems versus people that are inside the system trying to fix the problems, right? And sometimes you get people who have a blended identity like UCAS who, are both living the problems and trying to solve them. And there's folks like you, Gabrielle, who, are firmly trying to be allies to kind of pick up the things that they should pick up. Inside the chat, there was some discussion about, a paradigm that's been brought forward through thought leadership from our Western cousins, talking about, cedar baskets and copper pots, the idea that there are things that we should pick up and things that we should let other folks pick up. When you think about understanding what you needed to pick up, both of you have talked about mistakes and things that you learned. Um, what have you learned about what you need to pick up? And I think one other part of that question is how do you know how to pick it up in coordination with the other person? Because I think that that's sometimes something that's lost in that dichotomy. We both think that both sides are going to pick up stuff and things are going to work out. Like even with the two-row wampum, you have two people looking side by side. You're actually supposed to look at the other side. You're supposed to pay attention to, what they're doing and how they're approaching things so you can respond in kind. And maybe we could start off with you, Cass. What have you learned about what you need to pick up? And what have you learned about working with people who are picking up things that you shouldn't or can't?